But you can't promise when we will be paid next.
Yeah.
Well, imagine having to ask that question, especially less than 3 weeks away from Christmas. But it's the reality for employees of the hospital in Leadville. St. Vincent Health is in such bad financial straits that hospital officials say they were being honest with employees, saying they can't make payroll. 9 News reporter Cole Sullivan is live in Leadville, where county leaders are meeting right now, trying to decide whether or not they can bail the hospital out. Cole?
Tom, one county commissioner tells me this is the toughest decision he thinks he'll make in his tenure here. The hospital says it needs about $500,000 to pay doctors and nurses, its other 100 employees. If it doesn't get that, they're not getting a check tomorrow. Right now, just behind me, the county commission is meeting to decide whether to send that money to a hospital that's in bad financial shape in order to save health care in this town.
10,200 feet is nothing to sneeze at. You know, it puts a strain on the body.
In the mountains, winter freezes hard.
I love the cold, I love the snow, I love all of it.
It's a good thing John Mora likes it. He's lived in Leadville all his life. The town's hospital has been here that whole time too, and John's relied on it, like when a family member had a heart attack last month.
We have to have something for when things go wrong.
But now, John says there's something wrong at St. Vincent Health. He worked there in IT until September and says he left because the bills weren't getting paid. Cable and internet service to the hospital kept getting shut off.
None of my vendors were being paid. I figured it was just a matter of time until my check stopped coming in as well.
That's what's happening now. The hospital told the county it needs bailing out in order to make payroll for its more than 100 employees.
It doesn't look good now. Doesn't look good at all.
Not good for the employees, nor for the future of this hospital, which completed a $26 million expansion just last year.
Quite frankly, I'd be surprised if they made it to the end of the year.
John says he worries what the future of the hospital means for his family next time they need help, and what it means for this town he loves.
Honest to God, who's going to want to move to a town that doesn't have health care?
And we've just received word in the last 2 minutes the county commission did vote to approve that money. Less than the hospital wanted, though, $437,000 instead of the $480K they asked for. A hospital spokesperson says that they are committed to patients, staff and the community as they address this financial threat. That's their words, but it's true. The state tells me they've advanced this hospital already more than $1 million.
Well, a glimmer of hope for a little more for now. We'll see what happens the rest of the way. Thank you, Cole.